Well, good morning, everyone, and thank you, Mr. Chairman. As has been said, we're marking up 38 bills. That is a truckload of bills, mostly bipartisan, with 26 bills originating from the Health Subcommittee, which I have the honor of chairing. I think that the Health Subcommittee continues to be the workhorse subcommittee, and I'm very appreciative of the work of the staff, and I'm really proud of the members of the subcommittee for all the work that they've done. Importantly, we're going to mark up 12 bills that address the mental health and substance use crisis that we're currently facing during the pandemic and during this economic recession. September is National Suicide Awareness Month. So it's fitting that the legislation that we're considering addresses the spike in suicides, which is, I know families that have endured suicide, and it's a haunting, haunting death. So these spikes in suicide and increasing the funding for it and the coverage of high quality mental and behavioral health care, very important to take up today. We'll consider 5 bipartisan bills to continue and improve important health programs nearing their expiration. And I appreciate the committee's timely action to move these bills despite the demands of the coronavirus. We're also going to consider 2 bills that improve health insurance. The Ensuring Lasting Smiles Act, and I think all of the members of the subcommittee remember the testimony of the family with the child that they brought to us. It's going to help the youngest among us who are born with congenital anomalies, and the Medicare Enrollment Protection Act, which will help seniors navigate the really tricky process of transitioning from private insurance to Medicare. We've also worked to close the disparities in health outcomes by marking up the South Asian Heart Health Awareness and Research Act, and very importantly, the Tribal Health Data Improvement Act. This legislation is going to really strengthen the research conducted by the National Institute on Minority Health and Health Disparities. As a senior member of the CNT subcommittee, we're considering 2 bills on media diversity. They've been spoken to before by both the chairman and the ranking member, and I'm proud to co-sponsor them. We're also considering Representative Mike Thompson's Phone Act, which ensures that families can keep their landline phone number if their house is destroyed in a national disaster. Why this is ever the case, I don't know. In my congressional district, over 1,000 homes have been lost. We've had 77,000 evacuees. So these fires, as the ranking member stated, are really devastating, and there are so many impacts that come as a result of them. So this legislation, I think, is so important as we're experiencing this horrific wildfire season, including, as I said, the one in my district. So I'm very proud of the work that the subcommittee has done, and I look forward to all of these bills being marked up. I just would like to add, Mr. Chairman, I'm very disappointed that my legislation relative to the impacts of smoke from these wildfires was not brought forward. I've had contact with the ranking member. We're going to work on it. I don't know what happened with the staffs working or not working together, but it was too late to get it into the markup. But it really is important to, I think, to bring that one forward as well. So with that, I'll yield back the balance of my time, and thank you to everyone. It's great to see all of you.